Most people think dementia only affects memory. But what if someone's personality, behavior, and decision-making change completely, even before memory loss begins? That's what happens in frontotemporal dementia. Frontotemporal dementia, or FTD, is a group of brain disorders that primarily affect the frontal and temporal lobes of the brain. These areas are responsible for personality, behavior, language, and decision-making. Unlike Alzheimer's disease, which mainly starts with memory loss, FTD often begins with changes in behavior and communication. This makes it harder to recognize early on, and it's often misdiagnosed. So what's happening inside the brain? In FTD, nerve cells in the frontal and temporal regions gradually degenerate and die. This leads to shrinkage of these areas, which directly affects how a person thinks, behaves, and communicates. Abnormal protein buildup, such as tau or TDP43, plays a role in damaging these brain cells. Now let's look at the symptoms. There are two main types of FTD, and each presents differently. The first is behavioral variant FTD. In this type, personality changes are the most noticeable. A person may become socially inappropriate, impulsive, or emotionally flat. They may lose empathy, show poor judgment, or engage in repetitive behaviors. For example, someone who was once calm and responsible may suddenly act out of character. The second type affects language and is known as primary progressive aphasia. In this form, patients have difficulty speaking, understanding words, or forming sentences. Communication becomes slower and more frustrating over time. As the disease progresses, these symptoms become more severe, and patients may eventually develop difficulties with movement, swallowing, and overall functioning. FTD typically affects people at a younger age compared to other dementias, often between 45 and 65 years old. This makes it even more challenging as it impacts individuals during their working and family life. So how is frontotemporal dementia managed? There is currently no cure, so treatment focuses on managing symptoms and improving quality of life. Medications may be used to control behavioral symptoms like aggression, impulsivity, or depression. However, they do not stop the progression of the disease. Supportive care is essential. Structured routines can help reduce confusion and anxiety. Speech therapy can support communication difficulties, while occupational therapy helps patients adapt to daily activities. Caregivers play a critical role. They need to understand that behavioral changes are part of the disease, not intentional actions. Communication should be simple and calm. Avoid arguing or correcting harshly. Instead, focus on reassurance and redirection. Creating a safe environment is also important, especially as judgment and awareness decline. In the end, frontotemporal dementia is not just about memory, it's about personality, communication, and identity. And with the right support and understanding, patients can receive care that preserves dignity and improves quality of life.